Hi everyone, Whitney Lowe here from the Academy of Clinical Massage, and today we're going to be grappling with one of the challenging issues facing our profession, and that is whether or not massage therapy should become a college degree. This is a complex issue, and boy, it has led to a lot of sort of infighting and discussion in the profession for certainly more than the 3 decades that I've been involved with this, but this is a constant topic that comes up. So we're going to look at some of the pros and cons of that challenging issue today and how that might affect the profession in the future. So the first place to begin is asking the question, why might we even be looking at this question of needing to have a college degree? This goes back to the fact that our profession is really sort of these two main branches or categories. The first is massage as sort of a wellness service, what some people call a personal care service. So this is massage that you go get just for the sake of general relaxation, might be performed in a private clinic, might be in a spa, a health club, a cruise ship, or some type of place where the primary goals of treatment are just enhancement of your wellness and feeling generally relaxed. We do a pretty good job of training massage therapists in our entry-level training programs for this branch of the massage field. The second branch is when massage is used as a healthcare service. This is where we're talking about people who are using massage to address some type of compromised health condition, like this might be palliative care in a cancer treatment center, or it might be treatment of a sports injury or post-surgical case, some reason that massage is being used to address a pain and injury condition. This is often considered more of a healthcare approach to massage, and some people call this medical massage. There's all kinds of debates about what we really call it. We're going to call it, just for the sake of ease of language in this particular video, we'll just call this medical massage. And so that means the people who work in that type of environment or do that type of work have to get their training outside of their traditional entry-level education through continuing education courses or their own independent study. Now, there's absolutely nothing wrong with your own independent study and getting there and pursuing the things that you want to learn. But what it does mean is there isn't really standardized training or standardized education that we can assume somebody has if they're going to work in this environment. So when you think about it, a person can call a massage therapist up just right off the street and say, "Hey, I fell off a ladder and I hurt my back. Can I come see you?" And they can go see that massage therapist, and there may be some kind of really serious injury there that needs to be seen by another healthcare professional, or that might be something that the massage therapist can work with. But that massage therapist has to make the decision and the determination. And that means that there really should be some significant advanced training about how to make these clinical decisions that we're faced with. And that's really the crux of this whole argument about should we move to a college degree program so that we can train people more effectively for that. Now, I want to look at some of the major pros and cons of a degree program, and then we'll see if we can come out at the end and see what kind of ideas you have about whether that's a good idea or not so good idea at this stage. So in the healthcare arena, this is an area where I think most people would agree it's pretty good idea for people to have some kind of degree program to standardize the education. So when you think about similar professions to ours like physical therapy or occupational therapy or nursing, they all have standardized educational programs and require college degrees to complete those programs. So this is one place where we really differ since we don't have that requirement, and massage therapists really have a great deal of flexibility in whatever they want to do, that it does not necessarily require those degree programs. Now, there's other professions like personal training or cosmetology, which may not be as much in a healthcare arena, but there's certainly healthcare aspects to those that don't require college degrees, similar to like what happens with massage. So these are some good examples of those that do have degrees and some of those that don't have degrees that we can compare ourselves to. So what are some of those pros or benefits to getting a college degree for the massage professional? So let's run through a couple of those things that would be really pertinent for us to think as benefits to the degree program track. First of all, there might be a greater standardization of education, so it would ensure that massage therapists who are working in these different environments have some degree of standardized education, and we can count on and assume they would know a certain level of information. That can be really valuable in the healthcare arena. A college degree would elevate the status and professionalism of massage too, in terms of how it is perceived by those outside the profession. there's just a natural thing that people give greater credibility to professions or fields that require college degrees, in the healthcare arena at least, than those that don't. So that would increase the credibility and the view of massage by both other people in the healthcare field and probably from the public as well. Having a degree program might make it more likely that massage therapists might be invited onto other healthcare teams to work alongside other credentialed and degreed healthcare professions. It's a little bit more challenging sometimes for massage therapists to be invited into these environments because their education levels are seen as much less significant than those other professions. So this would certainly elevate them and open opportunities for a lot of massage therapists. Along with that, there's also the opportunity that this could potentially increase pay and compensation rates for some massage therapists working in some of these different environments. It's also possible that degree programs may encourage and facilitate greater research into some of the evidence-based practices that are used in massage therapy. So when we're trying to find ways to define and identify the key benefits of massage, or does it work for this particular thing or that particular thing, we have to have research to do those things. And it's hard to attract research interest into these programs when there isn't the same degree of academic rigor that there is for many of the other healthcare professions. So having a degree program would likely improve some use of research to support the basis of what we do in massage. So what are the cons or drawbacks to pursuing a degree program for massage? Well, one, it would significantly increase the time and cost of education for a lot of people, and that could potentially limit their accessibility to the profession. There's also some debate about how much would be really improved if massage went to a degree program. Would that additional time required be about massage, or would they be taking, courses in geography or writing or other things? Certainly writing skills could be a valuable course, but there's a lot of general education courses in a degree program which would potentially be required, and the question would become, is that really necessary for a person who's entering this field, and should they be incurring the costs to have to go through those additional courses to be able to practice and do what they're doing? There's also a big question with so many people who enter our field are coming into this from other professions. Like, they've got bachelor's degrees or even sometimes advanced degrees in other fields, and they want to pursue massage therapy. Well, if we make a requirement for massage therapists to have degree programs, and people come in and they don't have a massage therapy degree, but they've got some other kind of undergraduate degree program, for example, do they have to go and get an undergraduate degree in massage, or could their undergraduate degree program in another area be transferred to cover some of those requirements? That's a big question that would still have to be answered. There's also a lot of debate about whether or not a degree program that would be required for certain types of massage might create a greater degree of division within the profession. There could be a sense that some people feel people who have degrees for massage might be perceived as having higher levels of training, which they no doubt would, but is that going to make them a better massage therapist? Maybe, maybe not. And should they be paid more? That question is going to come up as well. So this is the kind of thing that's likely to create a tremendous amount of infighting and dissension within the massage therapy community if we were to have those divisions come about. There's also the potential for some degree of overkill in training. If people just do want to pursue only that sort of wellness tier or wellness character of massage, might that be something that's overkill if we're having degree programs? Now, maybe some of the degree programs could be voluntary, but then there creates all kinds of confusion for the public about who do I go see if I have an injury? Do I have to go see somebody with a degree, or could I get a quality care massage treatment from somebody who doesn't have a degree? And especially because we have so many people who've been around this field for a long time without degree programs, that's going to linger for quite some time. One of the other biggest cons or detrimental factors that I see to this whole model right now is the increasing cost of college. If you've been paying attention to the news anytime recently, you've noticed that there's all kinds of stories about the incredible increases in costs of college programs, mainly here in the United States, because education is handled differently with its costs in other countries, but I'm speaking predominantly here to the United States, where the cost of college has just gone skyrocketing in the last couple of decades. Estimates are that a 4-year college degree at a public institution, public state school, is somewhere around $25,000 per year. That means large majority of students are getting high degrees of student loans to pay for these college degrees. And the question comes about whether or not they can earn that much money in their massage therapy career because a lot of people cut their career short and move on to other things after a few years. Are you going to really get the return on investment for that college degree if it's costing you, anywhere from, $100,000 to $150,000 to get your undergraduate degree? Now, of course, there are schools that are less expensive. There are schools that are more expensive, but the reality is college costs a lot more than it used to, and it is very expensive for people. So that's a potential con to the degree program. So what other possible models might exist for addressing this problem that might be something not including the college degree? One of the things that has emerged in recent years is a discussion around something called micro-credentials. Micro-credentials are some type of credentialing program or a training program that's not the full length of a college degree, but it does give credit for the education that somebody has pursued. There's all kinds of, especially in the computer industry, there's coding boot camps and all kinds of mini training programs and certifications that people can earn. These are all called micro-credentials. And the world of micro-credentials might be the best strategy for the massage therapy profession because it could allow people to specialize in these highly specialized areas. For example, in that whole medical massage realm, the information that somebody needs to learn to practice palliative care in a cancer center is a lot different than the information they need to learn to work in an orthopedic and sports medicine clinic. Both of them would require some pretty significant advanced skills, knowledge, and training, but the skills and knowledge are going to be pretty significantly different. So a micro-credential, and again with a degree program, it might be really hard to separate those and have degree program tracks that will cover those things appropriately. But a micro-credential program could certainly do that. The massage profession in the United States started down this track a little bit in the last few years with the National Certification Board offering a group of specialty certificate programs, which I was kind of hoping would be a stepping stone to these micro-credentials. But unfortunately, they canceled that program within the last couple years because of logistical issues for administering them. So I'm still hopeful that we might have some kind of micro-credential programs that might emerge as another potential solution here. So without a doubt, this is a complex and challenging question, and we certainly won't come to answers to this quickly, but it is something that I think we're grappling with, and we need to address some of the pros and the cons and the possibilities for how we might navigate this challenging path of addressing how do we recognize and credential different levels of education within the massage therapy profession now and moving forward. I'd really love to hear your comments, so leave a comment in the section below. Let me know what your thoughts are on if you think college degrees are a good idea, bad idea. Do you think micro-credentials might be the answer? What's the best way to handle this? Okay, we'll see you in the next video.